welcome back. Today I am diving into a topic that can be a little controversial, but it's one that is really important: circumcision. So we're going to look at both the pros and the cons. I want to give you all the information you need to help make an informed decision if you're a parent or if you're just curious about the topic. Now, if you're new here, please subscribe and click the bell so you don't miss any of my videos. Now, I recently posted a little clip of a session with my first-time mom client that I am mentoring, and that included some discussion of how circumcision affected her newborn and breastfeeding within the first 48 hours. It was a little difficult time for her. Well, that clip brought out a number of comments, so that's why I wanted to create this video real quick today. It seems it's a very controversial subject anymore, and so I just want to start with the basics. First of all, what is circumcision? Very simply, it's a procedure that removes the foreskin, which is the skin that covers the tip of the penis. So while it's a pretty common procedure in some countries and cultures, it's definitely not universal. And for many parents, this decision is one they have to make quickly, and often in the first few hours, or even before giving birth, you might be asked if you're having a boy, are you going to have him circumcised? So depending on where you live and your background, you might feel like there's a right or wrong choice. But really, the decision is deeply personal, and there's pros and cons. So let's talk about some of the potential health benefits of circumcision first. Research has shown that circumcision can reduce the risk of urinary tract infections for infants. Some studies suggest it may lower the risk of certain sexually transmitted infections, including HIV, later in life. But there's also the argument that circumcision makes it easier to maintain hygiene because there's no foreskin to clean under. So the ease of hygiene is important for some parents, and it's one of the main reasons they can choose circumcision. Of course, it's not all about benefits. There's also risks and other concerns to consider. Like any surgery, circumcision does have risks. Though complications are rare, they can happen. This might include things like bleeding, infection, or issues with healing. Now, newborns are not born with the ability to clot blood effectively. Their bodies need vitamin K to produce the necessary proteins for blood clotting. So for this reason, it's become standard to give vitamin K shots to newborns to fill that gap until they've been able to produce enough on their own, which can take about a week. Keep that in mind as I get into the cultural aspect of circumcision a little bit later in this video. So another consideration is the pain involved. Many doctors use a local anesthetic to reduce pain during the procedure, but some parents worry about the discomfort for their newborn. I'm going to be really clear here about this procedure. Your newborn is going to be strapped down so that they cannot move. And while it'll only take a few minutes, I think you should be aware of that and what that looks like, because you're not going to be present for it, and your baby's going to be taken away from you for this procedure. Now, beyond the physical risks, there's also a lot of discussion around the ethics of circumcision. Since an infant cannot give consent, some people feel it's better to leave the decision up to the child when they're older. Now, let's get some of the cultural and religious reasons for circumcision. So in some cultures and religions, it's a tradition that goes back thousands of years. In Judaism and Islam, circumcision is a meaningful ritual. It's a significant rite of passage and often deeply tied to a family's values and identity. I just want to note here that the Jewish practice as commanded in the Torah is to take place on the 8th day of life. I just find that interesting because by that time, the baby should have already developed the ability to clot blood and heal more quickly, as opposed to having it done within the first 48 hours. It's almost like some divine creator that gave that commandment knew how it worked. Just saying. Even outside of religious reasons, cultural norms often play a big role. In some parts of the world, circumcision is simply the norm, while in others, it's far less common. So if you're a new parent from a culture where circumcision is expected, it might feel like a natural choice, but it's always helpful to explore why it's part of your cultural traditions and what that means to you personally. So I just want to take a second here. If you're finding this information helpful, go ahead and give this video a thumbs up and don't forget to subscribe to my channel. Also, I would love to hear from you in the comments. What are your thoughts on this? Have you faced this decision? Please keep it respectful, but I think others would like to hear comments from both sides, and I'd love to know your experiences and thoughts as well. Now, back to the pros and cons. An important part of this decision is the ethical consideration. For some people, circumcision brings up questions about bodily autonomy. Since infants can't consent, there are parents who feel it's best left to their child to make the decision when they're older. And this perspective is especially common in places where circumcision is not the cultural norm. Other parents feel it's their responsibility to make medical choices for their child's well-being, and that if the procedure offers potential health benefits, it's worth doing and doing early. So it's a choice where there's really no right or wrong, only what feels right for your family. If you're considering leaving your child intact, there's a few things you could learn about intact care for uncircumcised boys. Some people worry that not being circumcised could lead to hygiene problems, but the reality is that with proper care, intact boys can stay healthy and clean. For young boys, the foreskin should never be forced back, and it actually naturally retracts over time. So as long as you follow good hygiene practices and stay informed, intact care is fairly straightforward. Something else that parents might wonder about is the cost and access to circumcision. In some places, circumcision is covered by health insurance. In other places, it might be an out-of-pocket expense. Costs are going to vary depending on where you live, and that can be a deciding factor for some families. If you're planning to have the procedure, it's a good idea to check with your healthcare provider to understand the costs involved. And finally, I want to address some common questions. A lot of parents wonder about sensitivity. Research is mixed on whether circumcision affects sensitivity, so there isn't a clear answer here. Others ask about what pain relief options are available for newborns. Most doctors use a local anesthetic to help, and this can make your baby a little bit extra sleepy afterwards. It's very common for newborns to have this procedure done right away within the first 24 hours, but it can be done later in life. The procedure is often more complicated when you are an older child or an adult, though. So I hope this has helped you understand some of the pros and cons of circumcision a little better. Remember, it's a personal choice, and it's okay to have questions. Now, I'm going to insert my personal opinion here. First of all, I'm not crazy about the way I was presented with this decision over 30 years ago. There were really no facts, just if it's a boy, are you having him circumcised? And then followed by, most people just do the same as the father. Okay, that's not really an informed decision that I made, but that's the way it was. And secondly, I just can't help think that this whole Western culture of having circumcision done right away in the hospital 24 hours after birth is somehow a little contrived to just add on yet another clinical procedure to interrupt the natural process of giving birth. Like, can we just give it a hot second? I find myself wondering, like, do parents really understand how this can derail that important first 48 hours of bonding time and the breastfeeding process if it's done that soon? It's something I always talk to my clients about. I've never had anyone say that it did not in some way negatively affect their baby during that period. I mean, it's a painful procedure. It has to heal. And on top of all that, you know, this little squish has just entered the cold, bright world, and, you know, it's got a lot to deal with. So that's all I'll say about that. The decision that you make should be one that aligns with your values, your culture, and what you feel is best for your child. If you have questions and thoughts on this topic, please drop them in the comments. I'd love to keep the conversation going and hear your perspectives. Thank you for watching, and remember to subscribe if you haven't already for more videos on newborn care and making informed choices for your family. I'll see you next time. Thanks for watching. Make sure to hit subscribe and the notification bells